Kia koutou. My name is Jesse. I'm an anesthetic technician in New Zealand. At the moment, I'm working in one of the hospitals in New Zealand, and I'm gonna produce a lot of videos related to crisis management. So in New Zealand, when you work, each hospital or each theater, they have their crisis management card. So they will tell you what to do. So during the emergency situation, you have to take the card out and then read out loud, so we can deal with the crisis. So there, as you know, that in our daily work, there are a lot of things gonna happen during, before, during, and after the anesthesia. So the first video I'm gonna talk today is called hypertension. So what gonna cause hypertension, and what your first thought, like what happening, and how can we solve the problems, and how can we prevent the problem. So as I mentioned earlier, I will use the emergency card, one of the hospital I work in New Zealand. So you see that how in New Zealand, how people gonna correct the problem, how can they can deal with the emergency situation. So one day, if you move to New Zealand, you will know how you can normally know how we work in here. So New Zealand is a beautiful country, as I mentioned in earlier video, and hopefully one day you can go to New Zealand and work. And if you watch my video, so you can see that how it's the daily work, how I work in New Zealand, and how I deal with the situation like crisis events. So today I will talk about hypertension. So I got a lot of people from overseas asking me, like, of course you see that if you have a large anesthesia, pain, anything like wrong medication can cause hypertension. So and then he asked me if is there any reason why patient get hypertension. So to answer these questions, I think it's good for a student or someone gonna do the exam. So when you answer the questions, what happened to the patient? So there answer three main factors: anesthesia, surgeries, and patient related. So that's mean like, so you can answer the whole things that the examiners they want to ask you, or the teacher want to ask you why the patient got hypertension. Like, okay, so that's the main factor you can create a problem. So in this video, I will mention each factor, and then for the first, you see that it's hypertension. So you have to thought in your head straight away what happened. So what is the first thing you think about, and then the further reasons, and then how to prevent it. And then I will show you how I will take a photo. I will mention the emergency card in this video. So hopefully you can follow my channel and share and subscribe my channel. With the emergency situation like that, you have to pull out the emergency card, and you read out loud the hypertension. So quick check patient monitors. The patient is oxygenated, anesthetized like A, B, C, D, E. So A is airways, ET, CO2, make sure that we have a trace there. B is SpO2 vein setting, make sure we have deliver enough tidal volumes and oxygen for the patients. C is heart rate and mean arterial pressure. D depth of anesthesia, and E is temperature. Check accuracies of breathing. Check equipment, including transducer height. Frequent gamble on common causes. Check for stimulating surgical activities. Give analgesia. Check recent drug infusion. Recent doses for drug arrow, including local anesthesia with adrenaline. Check tourniquet time. Consider bladder volume, fluid infused. Systemically, through possible causes I will mention later on. And once all reversible causes have been addressed, then consider IVs, antihypertensive agents. I will mention later on. So the systolic blood pressure target will be roughly like 160 millicuries. That is the first thing you have to do when you see the high blood pressures like hypertension. That's the first thought. then you have to follow the further reason why we cursed like. Right, consider timings of events, drug administrations, surgical events, possible causes in most in both anesthesia. So, like I mentioned earlier, there are three factor: anesthesia, surgeries, and patient-related. So, anesthesia too light, not deep enough. Pain, hypoxemia, hypercapnia, MH, malignant hyperthermia. Drugs, consider error, IV lines, non-patent or in tissues, lines transducer height. Now it's surgeries with like tourniquet, like it's gonna cut pain and then high blood pressure. Aortic clamping, carotids, and rectomy. Baroreceptor stimulations, pneumoperitoneum. Then patient-related like essential hypertension, rebound hypertension, beta blocker stop, full bladders, preeclampsia, renal disease, phagocytoma is tumors on the adrenal gland. Patient have the thyroid storms or increase in cranial pressures that can cause high blood pressure. So there are three main factors like anesthesia, surgeries, and patient-related. So when the patient gets hypertension, we quickly check like what happened, what causes, and based on this factor, we have to correct each factor, and then the blood pressure will go back to normal. Right, to treat the hypertension in here in New Zealand, we do beta blocker like esmolol, 10 milligram boluses titrated, metoprolol, 2.5 milligram boluses titrated, maximum 15 milligrams. And then alpha blockers like labetalol also beta blockers, 5 milligram boluses titrated, maximum 100 milligram. Phenethylamine like 5 to 10 milligram IV, repeated every 5 to 15 minutes. Alpha agonist like clonidine like 30 microgram boluses titrated, maximum like 150 microgram. Vasodilators like G10, you can spray or you can IV infusion like 50 milligram in 50 ml of saline, and you give like 3 ml per hour, and titrate magnesium. Slow bolus 5 ml of 39.3% and repeat if required. Yes, that's all. That's very short videos, and but it's very useful information. Even though like we not normally don't get it quite often, like because like normally person have a hypotension, like low blood pressures when during the anesthesia, but sometimes come up like we never expected, like the blood pressure gonna go up. So it's good to have the to read and then remind you what happened, and then especially in New Zealand, like each theater they have the emergencies like crisis management card. So a lot of folk in the card you can flip it through and read it. So whenever I have time, I just read it through, and then because like if you keep reading it, and then you can remember. So next time if something come up, you can deal with the problems easier, and you can notify the reason, the causes why patient got high blood pressures. All right, thank you very much. In the next video, I will go through a lot of useful videos. So hopefully you can subscribe my channel and then follow my channel, and you're gonna share my channel to other people around the world, so they know how anesthetic technician work in New Zealand, and also how we deal with it, how we deal with the crisis, and how can we manage the emergencies events. All right, thank you very much, and see you in the next video.